Millions of people in Europe and around the world are struggling with the consequences of COVID-19. More than 4 million lost lives, many bankrupt businesses, and of course, a heavy toll on mental health, which was also the topic of the summit organized in Athens by the World Health Organization and the Greek Ministry of Health. To discuss about this and about the pandemic in general, we have with us the Regional Director for Europe of WHO, Hans Kluge. Dr. Kluge, thank you for joining us here on Euronews, and let's start this conversation with the recent development about the investigations of the international delegation in China regarding the origins of the virus. From one side, we have the head of the organization recently saying that maybe it was a bit too premature to rule out a leak, a laboratory leak. And from the other side, China rejected WHO plan for a second phase of an investigation. Do you have any indications leading to suspicion that there was a laboratory leak? And what are you going to do from now on?
I think that's a question for Dr. Tedros and WHO Geneva, because I'm the WHO Regional Director for Europe, which encompasses the 53 European member states, and China is not one of them. So I was not privy to the mission. So the information I have is the same as we are hearing from our Director General, which is that all options are on the table and should be investigated. But we should remember that the time that were investigations for the origin of the MERS or the SARS-1 virus, it took between 1 and 2 years and a half to establish some link between the virus and the intermediary host. So it's normal that such an investigation takes a little bit of time.
As an official of WHO, do you think it's going to be hard?
Well, I think that's a question, honestly, for Dr. Tedros and WHO Geneva, because I'm responsible for the 53 WHO European member states. China is not one of them. So I think it would not be fair for me, honestly, to give a comment on that one, as I'm not dealing with China. But I see that Dr. Tedros has issued a call for experts to establish an expert group to take now the second phase of the investigations forward. And I think we should give that investigation a little bit of time to move on.
So let's continue with what seems to be the way out of this pandemic, the vaccinations in Europe. Are the numbers satisfactory of the people vaccinated?
Well, the way out of the pandemic, I would say, is threefold. I call it VIP approach. The V from variants, we have to study very closely the variants, in this case the Delta variant, which is attacking people who are not or insufficiently vaccinated. The I from immunization, we need to scale up, so the answer is no, it's not enough yet. We have 26% coverage in the pan-European region. And then the P from people, we need to further engage with the people, encourage them to take the vaccine, but also adhere still to the public health measures, including wearing of masks when we cannot take distance of 1.5 meters.
And where do you stand about mandatory vaccinations? This is a very hot debate right now in Europe.
It's a very hot debate. So WHO encourages any measure to increase coverage of vaccination as long as it is legally and socially acceptable. But it should not be a first resort, because first we have to try to understand what's in the mind of the people, what are their perceptions, and then engage with the communities which are hesitant to get vaccinated. And we do have a lot of experience with behavioral insight service to convince the people, making use of influencers. Look who is hesitant and think who can influence those people in a way of dialogue.
What is happening in the rest of the world, like in Africa or in Asia? Are there countries left behind because they cannot afford a vaccine?
Absolutely. We see a huge inequity. There, even in the pan-European region, there are 10 countries with less than 10% of coverage. And you're right, if we look to some African countries, solidarity is the only way out. No one is safe until everyone is safe, because the aggressive Delta variant is crossing the borders. But I do see much more solidarity, including from Greece, which is donating vaccines to other countries.
How concerned are you about new variants? Do you think there might be new and more contagious and more dangerous ones?
That there will be new for sure. There has been hundreds and hundreds of variants, and we have been monitoring this since the very beginning, but often they are not so harmful. This Delta and Delta Plus already variant, we have to monitor very closely. But what's the solution? The more transmission, the more variants. In other words, we have to scale up the vaccination.
And let's go now to the reason you are in Athens, the Mental Health Summit. You presented survey findings about the impact of COVID-19 in mental health around Europe. Which are the key points of these findings?
The key points is that mental health was a challenge before the pandemic. It's the biggest cause of disability. 1 out of 6 people in, let's say, pre-COVID times had a mental health disorder. The big finding now from the survey is that every one of us is vulnerable. Everyone, even if you feel strong, one moment can develop a mental health disorder, particularly anxiety, depression, and that is what the Athens Summit is doing. I'm very grateful to Greece, to the Prime Minister, the Minister of Health, Kikelias, to lift mental health from the darkness. It has to be the cornerstone of our society, our way of living. Mental health is everybody's business.
Can you elaborate a little bit about the findings of the survey? What did it show?
We have to focus first and foremost on what we call high-risk groups. For example, the children, the adolescents, because they suffered a lot with the school closure. The schools are not only a setting for education, it also provides some social protection, for example, against domestic violence, which is not a very big concern. But also the survey showed we have to pay much more attention to our health and social care workers. And I really would like to express my appreciation to all the Greek and European health workers who have been and are still the heroes of this pandemic.
You have said that forging a new path for mental health promotion and care should be our goal. Do you think that this is possible amid restrictions because of the pandemic?
Absolutely. We have no choice. Extraordinary times require extraordinary solutions. And at the WHO Europe's governing body board in September, we hope to get a European action plan approved.
Dr. Kluge, thank you very much for this conversation.
My pleasure. Thank you.